injuries. Now, a lot of dancers have experienced these, and they'll often refer to having tendonitis at the ankle. That can be an experience, but actually it's not the most common condition that I see at the Achilles when I'm working with dancers. In this video, we're going to look at Achilles tendonitis, but we're also going to look at some other conditions that occur with the Achilles tendon. And then we'll also look at some other structures in that area that also can cause symptoms that often we mistake for being tendonitis. Let's start by having a look at the Achilles anatomy, where it sits in the body. We're all familiar with it. You can see it. You can put your hands on it. It's quite tangible to us. But what we'll see is it's an extension of our calf muscles. If you watch the video on Meet Your Ankle Joints, I'll get into more detail around these specific muscles. But this just gives us an idea. The calf muscles are actually made up of two muscles that are in layers that both come down and blend in and become that Achilles tendon, which then attaches to the heel. Now you'll see that word there, triceps surae. Tri means three, and that's because that outer layer of calf muscle, called the gastrocnemius, we call it gastrocs for short, it actually goes up behind the knee and it splits into two what we call bellies. It has kind of two attachments at the top onto your thigh bone just above the knee. So that counts as two heads. Then underneath that muscle, we have a deeper one on the right there called the soleus muscle. That makes number three, so that makes a triceps, three muscle bellies. And that's the collective name, just in case you see that term flying around. But basically, we just call them the calf muscles. The gastrocs on the outer layer, the soleus on the deeper layer, they both come down and attach into the heel to become the Achilles tendon. Now in that middle picture, you'll see I've put there musculotendinous junction, a long name, but it kind of does what it says. Musculo, so where the muscle comes down, we're looking at the soleus in that picture. Where that muscle becomes the tendon. So remember, tendons are an extension of our muscle fibres that attach the muscle to the bone. So as the elastic muscle fibres come down, they start to become thicker and more rope-like and become that tendon. Where that happens, that transitional phase of muscle fibres into tendon fibres, we call the musculotendinous junction. I've highlighted it here because it's the most common place for us to get calf strains. When you have that tension in the calf or you've had a little tear in the calf muscle, then often it's that musculotendinous junction that has cause those symptoms or is the location of those symptoms because it's a load point in the muscle tendon unit. Watch the video on muscle injuries, watch the video called Meet Your Soft Tissues to get more definition around the makeup of these various different types of soft tissue in the body. Let's look now at some of the issues we get with the tendon, and we'll start with that familiar one, tendonitis. Achilles tendonitis just means inflammation of the Achilles. Itis means inflammation. We can get tonsillitis, bronchitis, appendicitis. It's inflammation of the fibres that make up the Achilles tendon. In that zoomed out view there, you're seeing a tendon under a microscope, and you'll see that it's made up of these individual strands or fibres that bundle together, and then each of those bundles are bundled together, and we get this repeating pattern of fibre bundles that eventually make up the tendon itself. These fibres are made of collagen, and they can be prone to inflammation. A tendon has a good blood supply. It doesn't have as rich a blood supply as a muscle, but the blood is obviously bringing the ingredients that heal the tendon. If we tear some of those fibres, then you're going to get bleeding there. And anywhere that you've got tendon or fibre disruption, then the body is going to want to plug that leak. It's wanting to stop the bleeding. So it's going to send healing ingredients. Just like when you cut your skin and you get red hot and swollen, that's a healing mechanism to bind up that open wound. Go and watch the video on inflammation to learn more about that. Here we've got the same process going on sort of within the tendon itself. So tendinitis is really just fraying or tearing at a microscopic level some of these fibres, and then you're getting an inflammatory process as a result. Now, tendinopathies, anything that's a path with PATH means something that's gone wrong with a particular area. So tendinopathies is a collective term for things that go wrong with a tendon. We talked about tendinitis briefly there, but there's also something called tendinosis. Now, this is actually the thing that I see more commonly with dancers' tendons that often get mistaken for tendinitis. So what's the difference? Here we're going to discriminate between those two so that you can understand which bucket your tendon issue might be falling into, because the way we address these issues is slightly different. We need to know what we're dealing with before we know how to deal with it. Tendinitis, we mentioned, is an inflammatory condition, and we tend to refer to that as an acute problem. Acute means it's happened rapidly and you're in the first sort of 24 or 48 hours of that injury having occurred. We mentioned that it involves micro tears of the fibres of that tendon. Tendinitis tends to be caused by some sort of sudden issue. So say you landed awkwardly from a jump and you put a strain force through that tendon, your foot rolled inwards perhaps, and it was a sudden overload of the tendon. Maybe you weren't warmed up properly and you did some sort of ballistic movement and the tendon just didn't have enough give in it to be able to comply with that movement, and then it cause those fibres to tear. So a force that is heavy or sudden. So those are the things that typically cause the tendinitis issue. As a result, you're going to get heat, swelling, often redness that's visible around that tendon. It's angry, right? And you're getting sharp pain from it. When that happens, you really want to be looking at anything to reduce the inflammation. Again, watch the inflammation video on tips on how to use ice and things like that to address the inflammation. And the recovery time for that, on average, around 4 to 6 weeks, but it will depend on the severity of that injury that you've done. Tendinosis is not an inflammatory issue. That means that there aren't all those ingredients that lead to that inflammatory process. They're not present in tendinosis. Tendinosis is more a degenerative condition of the tendon. This is where some of those collagen fibres we saw get disrupted, but they're not in that inflamed state. This is more an issue that comes from chronic overuse, wear and tear over time. If you keep stressing that tendon, stressing it, eventually those fibres start to disrupt. And what you notice is you start to get a thickening to the tendon. You'll often see that the tendon that you're getting the symptoms from looks bigger or feels thicker to the other one. They don't match anymore. Sometimes you have it in both. But this is where those collagen fibres start to get disrupted, and you actually get extra kind of growth of fibres around there, but it's not organised and structural. It's kind of more chunky regrowth of tissue, which causes this thickening. So with this, it's still painful, but it's more of a sort of grumbling pain rather than that sharp, acute pain. Clicking is often present with tendinosis, real stiffness in the joints, very slow to get going in the morning, for instance. This sort of issue really needs good physical rehabilitation. We will get into more treatment modalities later in this video. We need to do something called eccentric loading. Again, I'll talk about that later. And this is a slower recovery time because it's something that's built up over time, and therefore it's going to take longer to get better, and it could be anywhere 3 to 6 months. Doesn't mean you're not doing anything for that time, but you really have to be mindful that that tendon can be weak, and you need to treat it with kid gloves while it's in that healing phase. Let's look at some risk factors for this issue going on. Now, one of the main ones, and you'll hear me talk about this in so many injury videos because it is the root of all evil when it comes to issues for our body, rolling. The term for that in the anatomical language is overpronation. When our ankles roll inwards. This may be something that is a technique issue for you. If you're a classical dancer working in turnout and you're over rotating those feet beyond the availability of the structures above it, then you're rolling those ankles in. But it also can be a more mechanical issue where the arches of the feet have dropped down a bit. Watch the Meet and Greet Your Feet video for more information on the arches of the feet and things that can go wrong there. But when we look at the Achilles, it goes obviously down the back of the leg and it runs north-south, right, from top to bottom. Those fibres we looked at run in that straight up and down orientation. That Achilles can take huge loads when it's loaded in its up and down alignment. When you're running or jumping, that tendon can be taking up to 8 times your body weight as you come landing down from a jump. So it's a very strong structure if you load it in its neutral position. When you roll your ankle, and if we look at that picture on the right there, you'll see that overpronated foot. Rolling causes that Achilles to sort of bow slightly. If you look at somebody standing in parallel from the back view when their ankles are rolling in, you'll notice that that Achilles is slightly bow shaped. It's not going straight up and down. What that means is when you land from a jump, the forces are going to come through at an oblique angle across that Achilles, a diagonal line rather than a straight up and down line. That's going to cause those fibres to start to fray and degenerate. And if you keep repeating that over time, that can lead you down to this tendinosis issue that we talked about. If you're doing a sudden kind of land into a roll position from a jump, that can put you in that tendinitis position. And sometimes you can dance between the two. Often tendinitis can occur in a tendon that's been weakened over time with tendinosis. It's all very confusing, but we can sort of dance in and out of acute phases where inflammation does bubble up and then it goes back to its grumbly ways afterwards. But it's this repetitive loading in a non-neutral position that can predispose us to this issue. Go and watch the Managing Your Turnout video for more information on this. Turnout isn't just about being in ballet class and being in turnout. Even in parallel, we need to be often recruiting the turnout mechanism to line up those Achilles into their neutral alignment. Another condition to consider here is something called calcific tendinosis. Calcium, you think of calcium, makes up your bones, and bones are constantly remodeling themselves under load. So if you're loading a bone, it keeps regenerating itself and building more bone to take that load. What can happen sometimes if that attachment of your Achilles to the bone is yanking on the bone all the time, you're stressing it, the body wants to protect itself. If you think of the example, you lean on your elbow a lot, then you'll end up stressing the skin around your elbow and you'll often get a patch of hard skin there. Wherever we stress things in the body goes, if you're going to keep leaning on that, I'm going to thicken it to protect it. If you are constantly tractioning the attachment of your Achilles into the bone, then the body might think, I need to thicken this, and it'll start to put calcium deposits into that tendon attachment to protect it. But what you've now got is that bony formation coming into the tendon, and that means that the bit of tendon above it is going to be prone to more flare-ups, more irritation, because now it's got bone in it as well. This is something it's not common to get this, but I'm putting it in here because it can be a feature. There are other more medical conditions that can predispose this. Issues with the thyroid, with diabetes can often be part of why we tend to produce more calcium, and therefore it may be something that's not to do with mechanical loading, but something more to do with general health. But it's something that needs to be considered, and if you're working with a medical professional with your tendon issues, they might be screening you for this, so you need to be aware of it. The rehab for this sort of issue is very slow and steady. There are some medical interventions that can be done, things like shockwave therapy or needling into the area to try and break down the calcium deposits. In extreme cases, surgery may be required, but that's really quite a rare situation. Just thrown it in here so that you're aware of it, but it's not something that all dancers will experience. Similarly, Achilles tendon ruptures can happen, not common. This requires a real strong force for it to happen, and often it'll happen in a tendon that's been worn over many years. You've had tendinosis for years on end, and then often later in life this may be something that can happen. Really not common. I've probably seen about 4 or 5 in all the years I've been doing this, and often they didn't even occur in the dance situation, but maybe the irritation of that tendon over many years predisposed it to go. But essentially a tendon rupture is when you're getting either a partial or full thickness tear of the whole tendon. So in some cases it literally breaks apart. In others it almost breaks apart and there's only a few fibres remaining. When it happens, it's very, very sudden. You get that sudden pain. You're literally going to kind of collapse to the floor because the leg will give way underneath you. And people will say the sound is quite incredible. It can often sound like a gunshot's gone off and everyone in the room went, "What was that?" It's a loud pop or snap that you hear. And people will report that they often feel like they thought someone had kicked them, and they'll turn around and look behind them because they think somebody's just kicked them in the ankle because the pain is quite strong. Those tendons are held under a lot of tension, so when it goes, it's like a rubber band kind of snapping up. Afterwards, it's going to be very painful, and you won't be able to rise up. If that tendon's not connected, you won't be able to sort of weight bear just on that leg. And if you try and do a single leg rise, it's just not going to work. You're going to get a lot of swelling and bruising around the area because there'll be a lot of bleeding. Immediate medical advice. You've got to go and look at that straight away. The sooner you get it looked at, the better, and the better your rehab will be. If you leave these things over time, it's less easy to rehab the area. But you're going to know about this when you do it. But it's something that will require immediate medical attention and potentially will require surgery as well. Again, not very common, but it can happen and often happens later in life. Remember, as a younger dancer, you need to be advocating for your older self and make sure that you're taking care of these tendons so you don't get into this territory. Now, just some other structures that are around the Achilles that might cause pain and often get mistaken for Achilles. Everyone wants to blame the Achilles in that area, but there are other things that can cause issues too. The bursa is a name for a little sac of fluid. It's like a little pillow or cushion that you will often find wherever a tendon attaches to a bone. You will find a bursa. The plural for bursa is bursae, which is what you'll see there, ankle bursae, because we've got two around the Achilles attachment. There's one that is deep to your Achilles tendon. So if you think of where you can touch your tendon on the back, underneath that tendon, between the tendon and the heel bone, you've got something called your retrocalcaneal bursa. Retro means behind. So that will often get irritated if you've got an Achilles tendon problem. If that Achilles is frictioning and pulling around the bone attachment, then often it'll rub on the bursa and you get, guess what? Bursitis. The more superficial one is called your tendocalcaneal bursa. And that's actually, you can actually get your hands onto where that sits. Where the Achilles attaches into your heel bone, it's called your calcaneus, hence the tendocalcaneal bursa. Where that Achilles attaches into the back of the heel, you've got those little creases in your skin there often. It sits just under there. If you're getting a red swollen blob at the back of the heel, it can be an inflamed bursa, bursitis. That one usually gets irritated by something outside of you, something external. It can be a shoe rubbing, it can be the drawstrings of ballet shoes particularly cutting right across that bursa and irritating it. It can also be involved in a mechanical load, but more often that one's involved in something frictioning and rubbing on it. Let's drop down to the left there and we'll see the Haglund's deformity. Oh, goodness, that sounds so dramatic. It's really not. Lots of dancers have this, even just in a mild form. I do on both of my heel bones. Haglund is just because it's the name of the person who described this condition. And again, this is typically caused by rubbing of shoes on the outside. And you'll see that little bump on the outside of the heel bone, just where that Achilles is attaching. So this is on the heel bone itself. If you've got quite high arches as a dancer, your heel bone is at a bit of an angle. Watch the foot video to get an idea about arches of the feet. But if you've got a high arch and you've got quite a tilt to that heel bone, the back edge of it sticks out a little bit more and it can be more prone to rubbing. Remember I said that if you rub things in the body, they will thicken to protect themselves. So something that's more prominent will rub on a shoe and therefore start to build an extra bony bump. Again, drawstrings of shoes, if you're somebody that likes to pull those drawstrings, say in point shoes really tight, it can cut right across there and rub, which is why dancers often get these Haglund's deformities. A lot of people, it doesn't cause any problem. I don't have problems particularly with mine, but there are certain shoes, just like regular shoes, that just sit right across that bit or a bit tight around there that rub on it and then it gets annoyed. Another muscle we need to be mindful of is the plantaris muscle. It's a muscle that starts up above your knee and it actually is part of knee movement, so it helps to bend our knee. But you can see it has this really long, thin, stringy tendon that comes all the way down and it attaches into the heel bone right next to your Achilles. It's actually slightly on the inside of your Achilles tendon. If you're getting pain on the inside edge of the Achilles rather than the whole Achilles, it may be that it's actually the plantaris that's in trouble or causing the symptoms. So sometimes it can be mistaken for an Achilles issue when it's a plantaris issue. The plantaris is a small muscle, it's not very powerful, but one of the movements that can irritate it is doing sort of a lunging movement. If you kind of shoot your foot out and drop onto it quite heavily, it can load that plantaris muscle and maybe cause an acute tendinitis of the plantaris tendon. Sometimes it can get irritated in concert with the Achilles tendon. You've got a problem with both. But again, it's just something to be mindful of. It may be your plantaris if it's just the inside edge of your Achilles and not the Achilles itself. And we need to be specific so that we can make sure we're addressing the right tissue. Again, a healthcare professional is going to be able to help discriminate between those two. Okay, so what do we do about this? Now, we saw that the Achilles is the tendon of the calf muscles. Remember, if you watch the Meet Your Soft Tissues video, I talk about how tendons can't really be tight because they don't have the ability to contract. They might be under load because the muscle above them is tight. When you're addressing tendon injuries, you have to address the muscle above them. When you drop the tension out of the calf muscles, you buy yourself more slack in the tendon, then it's not going to pull and rub on that heel bone attachment. Stretching the calf muscles is key. Now remember, you saw at the beginning, we have 2 layers of calf muscle. That outer layer, the gastrocnemius, the deeper layer, the soleus. Those require 2 different types of stretches. Watch the Safe Flexibility Stretching series where I will take you through how to stretch these muscles. But essentially, when you're doing a calf stretch with a straight back knee, you're stretching the gastrocs muscle. The soleus one needs a bent back knee because it doesn't cross the knee joint. It only crosses your ankle joint. And typically, that's the one I see more trouble with. And it's the one that people are typically not stretching. They're only doing the straight leg calf stretch position, not the bent knee one. Watch the Safe Flexibility series on the lower leg muscles and I'll talk you through all the sort of do's and don'ts and how to refine those stretches correctly for the appropriate tissue. Standing on a slant board can also be useful to stretch out those calf muscles. If you do it with a bent knee on a slant board, you'll again be targeting that soleus muscle more deeply. But do watch the stretching video on the lower leg muscles for more specific information. If you're getting tendonitis, if you're in that acute inflammatory phase, then ice can be useful. Again, watch the inflammation video for more on how to ice safely. If you're in the tendinosis kind of bracket, really, you haven't got inflammation, you've just got degeneration. Ice is not necessarily as useful in that condition. For all of them, manual therapy is. You really want someone to get their hands in there and help to reorient the fibres, get the fibres aligned back into their correct neutral alignment in order that your recovery is optimal and you're not going to go down the road of having recurrent issues. I mentioned earlier, particularly for your tendinosis issues, eccentric loading. If you watch the video on Meet Your Soft Tissues, I'll talk about what an eccentric contraction is. But essentially, for the calf muscles, we really want to be going up, and we're doing this on one leg. Work with a healthcare professional to know when this is appropriate to put into your rehab program, because it's very strong. This is quite a loading exercise. It says it in the title, and you need to make sure that that tendon is ready for it. But I'm just giving it to you here so that you know why it's being given to you by a healthcare professional. But take advice on when to do this. But essentially, it's just doing straight leg rises on one leg. When you lower down from a rise, the muscle is both contracting and stretching at the same time. It's putting quite a pull force through that muscle and the tendon itself, which is helping to pull and realign those fibers into their neutral position. We can be doing that from a bent knee to a sort of rise position and back to a bent knee to address the soleus muscle as well. But you're addressing the muscle tendon unit with that kind of protocol. But again, take some advice from a healthcare professional on when, how many repetitions to do that's specific to your particular injury. Generally, just to take care of our Achilles tendons, plyometric training is really useful. I'll do whole videos on this. This is a form of training that helps us prepare our Achilles and our calf muscle lower leg structures for the ballistic forces that come through them when we're doing jumps. We really need to be preparing those tissues and keeping them fit for purpose so that we are safe when we're doing our jumps. It's a vulnerable time, particularly landing from jumps. Plyometric training is a form of training that will help you prepare the body for that. You've got to take care of the cause. Remember that a lot of this is caused by misalignment of the feet. Address the rolling. Watch the video on rolling to learn more about how to correct that. But we also need to look at the whole, what we call kinetic chain, the whole movement chain through the body. Jumping, rising, anything that's loading up that Achilles tendon is not just about the Achilles and calf muscles. We need to look at the strength in the upper leg muscles, the hip muscles, the spinal and core muscles. Everything is involved. The more tone we've got in the muscles above these structures, the less body weight is falling into them when we land from a jump, for instance. So we need to look at Achilles rehabilitation within the context of the entire body. Right, well, that was a crazy whistle-stop look through all the types of issues we can get around the Achilles tendon. It is a vulnerable area, but when you understand the anatomy, it's going to give you a lot more power to make sure you don't get into these problems in the first place.